The bill for an act to establish the Advanced Healthcare Development Fund 2020 was read for the first time on Wednesday, 11 March 2020. Mr. President, distinguished colleagues, permit me to proceed by making this point. Evidence abounds as to the existence of top medical doctors and other health professionals of Nigerian extraction practicing in some of the foremost medical facilities in Europe and America. Indeed, there are copious and sustained testimonies to the effect that these Nigerian doctors, lay health practitioners, are some of the best in the world, practicing across continents and harvesting in the process exemplary and unprecedented medical feats. It is also common knowledge that some of these globally accredited medical experts and icons are here with us in medical practice in health facilities across the Nigerian landscape. Mr. President and distinguished colleagues, the foregoing explains why it is terribly disturbing to note that the current state of tertiary healthcare in Nigeria can only be described as grossly inadequate and unable to meet the health needs of the citizens. Nigeria's tertiary healthcare system has been ranked 162nd in the world, with the adequacy of healthcare practitioners ranked 119th. Health facilities ranked 131st, care systems ranked at 162nd, and health coverage ranked at 149th. Put simply, Nigeria is not performing well in any component of the advanced or tertiary healthcare delivery system. Furthermore, most recent and extant data from WHO's Global Health Observatory indicates that our current tertiary health challenges span infrastructure to personnel inadequacy. For instance, it is saddening to note that priority healthcare technologies like telecobalt units, linear accelerators, and radiotherapy units have a density of 0.03, 0.05, and 0.07 per million population respectively. Nigeria has a poor ratio of approximately 4 doctors for every 10,000 citizens, 15 nursing and midwifery personnel for every 10,000 citizens, 1 dentist for every 10,000 citizens, and 1 pharmacist for every 10,000 citizens. This agonizing situation is largely occasioned by the fact that of the approximately 72,000 doctors registered with the Medical and Dental Council of Nigeria, over half currently practice outside the country. Indeed, the Nigerian Medical Association has said that about 2,000 medical workers leave the country annually to seek greener pastures in developed countries. This and other indicators undoubtedly paint a very woeful picture. Mr. President, distinguished colleagues, some may want to argue that there are teaching hospitals dotted across the country, and we must admit that some of them are intermittently fighting through their challenges to stamp their authority in research breakthroughs in preventive and curative medicine. However, in the main, we must make bold to categorically state that most of these hospitals are totally unable to meet the purposes for which they are established, owing to the myriad of challenges, including poor funding, corruption, infrastructural decay, and a crushing bureaucratic architecture. Justification. Mr. President, distinguished colleagues, it is this sickening scenario that has cast a pall of despondency on the climate of Nigerian healthcare service delivery system at the advanced or tertiary level. In the process, our medical experts in Nigeria have become thoroughly dispirited, while their colleagues abroad are truly scared of returning home. As a consequence, we have all lost confidence in the ability of our tertiary health structure to cater to our health needs in specialized areas. As we all know, tertiary care is a specialized consultative health care, usually for inpatients on referral from a primary or secondary health professional, in a facility that has personnel and equipment for advanced medical investigation and treatment, such as a tertiary referral hospital. Examples of tertiary care services are neurosurgery, cancer management, plastic surgery, cardiac surgery, advanced neonatology services, treatment for severe burns, and other complex medical and surgical services. This explains why only a comprehensively thought out and a sustainable and fiercely committed intervention in this sector will suffice. Available evidence, for instance, indicates that stopgap measures such as the Federal Government Special Intervention Fund of 2018, where each teaching hospital was scheduled to get 300 million, federal medical centers 120 million, while each fistula center and specialist hospitals will receive 120 million to improve healthcare service delivery, could not avail much at all. This kind of intervention will not suffice in bringing about the much needed change in the tertiary health sector. It's against this backdrop that this bill proposes what will be known as the Advanced Healthcare Development Fund. Objectives. 1. To evaluate and re-engineer our entire advanced medical architecture with a view to bringing it maximally up to speed with available practice anywhere in the world. 2. To provide new and maintain, improve existing infrastructure essential for tertiary healthcare services. 3. To carry out trailblazing medical research and publications. 4. To provide for training and retraining of clinical staff across the country. 5. To provide a robust structure that has the capacity to proactively deal with emergent health emergencies, such as we presently face. 6. To stem the loss of multi-millions annually from Nigerians who engage in medical tourism abroad that only benefits other countries across the world. Funding. Funding should derive from 1% of the Consolidated Revenue Fund and 1% of tax from all companies operating in Nigeria. Mode of operation. The fund should be administered by an independent body of tested and proven health professionals and experts of Nigerian extraction sourced from within Nigeria and abroad. The board should have a government representative, a civil societies component, and representatives from the WHO. However, everything must be done to sequester the fund from being mainstreamed into the grip of bureaucratic orthodoxy. Conclusion. Mr. President, distinguished colleagues, it goes without saying that a properly developed, adequately funded, and thoroughly calibrated healthcare system at the advanced or tertiary level equips the nation with a standing research apparatus that enables it to proactively respond to any emergent medical emergency. Today, the sad reality in our country is that no such structure in functional and real terms exists. This explains why the present coronavirus pandemic took us by storm and is being approached in the panic-prone and episodic manner that we have witnessed. This certainly cannot be allowed to continue. Health is wealth. This cliché remains true for all times. A healthy population stimulates hope, while the reverse breeds all-round lethargy. We cannot sit idly by and watch our health sector collapse abysmally. We must all rise up to save our nation, and the time is now. I have no doubt in my mind that this bill on Advanced Healthcare Development Fund and matters connected there with 2020 is an initiative that should come alive to address the gaps that we see in our current healthcare delivery system at the tertiary level. I therefore, without reservation, most respectfully, urge Mr. President and distinguished colleagues to commit this critically imperative bill to second reading. I so move, Mr. President. Thank you.
Senator Ojang Onor.